fault. I did upload my slides as I was instructed to do, because I'm afraid of Professor Torino. So my own disclosures, important to begin on the right note. When I was the editor of the Journal of Thoracic and Cardiovascular Surgery, I really didn't even think about conflict of interest in any way. I knew it existed more or less, and I didn't think it was a big deal. And I was sitting in my office one day, kind of waiting to go to the operating room, and the telephone rang, and my assistant said, there's a fellow named David Armstrong on the phone, and he's from the Wall Street Journal and would like to talk to you. Well, I know he wasn't asking me for financial advice, so I figured I better take the call. And the call kind of began with, "Did you know that?" And that's never a good thing. We had just published a couple of articles. In one, conducted at a major and highly credible institution, they studied a device to treat atrial fibrillation and had shown good results using this device. And what he asked me was if I knew that the institution owned stock in the device, and if I knew that the primary investigator was on the advisory board for the device. And then he asked me about another article that we published, in which an investigator reported his results with a device to treat atrial fibrillation using a minimal access approach. And he asked me if I knew that the investigator had in fact invented the device, and that the investigator was an officer of the company that made the device. This was my response. I suddenly became interested in the issue of conflict of interest. What is conflict of interest? I'm going to give you a very wordy definition, quoted, so Ian Beecroft will not accuse me of plagiarism. And I'm going to give you a much simpler one after it. So a very technical definition would be a conflict of interest is a set of conditions in which professional judgment concerning a primary interest, such as patients' welfare or validity of research, tends to be unduly influenced by a secondary interest, such as financial gain. That's pretty technical, and I think a much, much simpler definition is this. Think of a conflict of interest existing anytime there's a financial or personal relationship that might embarrass you if it were revealed at a later time. And on that one, I'm quoting myself. The reality is that most of us have conflicts of interest. And I remember the very first slide that was put up, which said that if you don't have a conflict, I think Larry Cohen, if you don't have a conflict, you're probably not an expert. So conflicts of interest occur in many, many subtle forms. And you can ask yourself, who paid your way to this meeting? Who sponsors your research? Have you been taken out to dinner recently by someone in the industry? Are you on a lecture circuit? Do you consult for a company? Do you do it for a fee? Or do you receive stock options? I do, and many others do as well. And how about if you review manuscripts for journals? You get a journal from Dr. Cohen or Dr. Edmonds or Dr. von Segesser to review. What do you do when you get a manuscript written by a friend? Or what do you do if you get a manuscript written by people you don't like? Maybe someone who got your sister pregnant. What do you do when you get a manuscript from a competing laboratory or a clinical unit working on a similar problem to your own? Or manuscripts that discuss devices from companies with which you have a relationship? And you yourself, suppose you've developed a device or drug or procedure. Are you investigating your own device, drug, or procedure? Are you investigating someone else's device, and in the course of those investigations, are you making a profit from the studies? Who controls the data? Where do you meet to discuss the study? It's the finest restaurant in town. Monetary gain is not the only conflict that arises. Sometimes conflicts of interest arise related to career enhancement or peer recognition, or the opportunity to advance your own research program, or scooping the competition by using information you acquire in reviewing a manuscript, or sometimes by adversely affecting the outcome of a manuscript, so you kind of divert the field for a little bit of time to allow your own work to surface. It has been shown that most authors do not disclose their conflicts of interest. And the reason for that is many authors think it will diminish the impact of the work that they publish. And of course, many authors believe that they can manage their conflict of interest, so it's not a big deal to disclose it. The next 3 slides talk about whether or not conflict of interest matters. One of the people who's written most extensively on this is Richard Smith, who was the former editor of the British Medical Journal, and this is taken from one of his articles. And it's a confusing slide, so let me just summarize it in words. What was done was they evaluated the general response of 3 classes of authors to calcium antagonists in this instance. And these authors were either supportive or neutral or critical of the work that was presented, and they looked to see if they had a relationship with the specific product that they were discussing, or if they had any kind of relationship with the pharmaceutical industry, or if they had no relationship. And using a statistically valid method, it was demonstrated that the probability of a more favorable response to the article was highest when the author had a relationship directly with that company, but in fact that any relationship with any pharmaceutical company had a statistically verifiable probability that they would be more favorably inclined towards the article and would support it. So it's subtle, but there is clearly an influence of a relationship. Again, from the British Medical Journal, the question was, do oral contraceptives predispose to venous thrombosis in women? There were 3 major randomized clinical trials that were unsponsored, meaning no pharmaceutical industry support was obtained. They all demonstrated a higher risk of thrombosis. There were 9 unsponsored studies of venous thrombosis in women taking oral contraceptives, and they demonstrated an odds ratio of 1.5 to 4, or a mean of 2.4, that is a higher risk of venous thrombosis in these women. And there were 4 studies sponsored by the pharmaceutical industry making the drug, which interestingly showed an odds ratio of 0.8 to 1.5 or 1.2, a trivial increased probability of developing venous thrombosis. With regard to passive smoking, 160 reviews were done, and 37% concluded that passive smoking was not harmful, and the other 63% concluded that passive smoking was harmful. When a multiple regression analysis was done that very carefully controlled for article quality, peer review status, the article topic, year of publication, the only thing that turned out to be statistically significant in determining whether the article favored or did not favor the concept that passive smoking mattered was whether or not the article was sponsored by the tobacco industry. And in the course of these 106 reviews, only 23% of the reviews disclosed a relationship with the sponsoring company. And there's the reference for the original article. So we should think of conflict of interest as a condition and not a behavior, meaning you have it or you don't have it. And as physicians, we generally do not consider self-treatment to be optimal. And if we accept that conflict of interest is a condition, then the management of that conflict should not be done by the individual who is conflicted. Like patients, the condition should be disclosed and the treatment left to others, editorial staff, some panel that decides whether your disclosed conflict of interest renders you incapable of making an entirely unbiased assessment of any particular situation, and sometimes it's left entirely to the discretion of the reader. So we say that the simple solution is disclosure. Well, in the case of the journal, we had a policy on disclosure, but we did not realize that there was no punitive component to it. And we have to accept that editors, university presidents, colleagues, and even readers themselves, in fact, are not policemen. So we cannot play the role of detective. And what we rely on is the integrity of everyone who participates in this intellectual process of publishing their work. And because we rely on the integrity of others, the penalty for failing to disclose a conflict of interest should be very severe. And like plagiarism, it should result in not being allowed to publish for some period of time as a consequence of deliberately misleading people who review your article, people who read your article, or people whose articles you have reviewed one way or another. Well, my final slide is, and I hope it will play since I had to reload this, is if we say that there's a simple solution to conflict of interest, let's see whether this will play. Well, it won't, I'm sorry, but let me simply say that complex problems rarely have simple solutions, but at least in the area of conflict of interest, disclosure is really the simple solution. Thank you very much.